Innovate is brought to you by
Get in the box with Airtel Yola Maja, where you can Yola up to 2 million shillings daily or up to 20 million shillings in the grand finale. Dial *185# for Airtel Money.
Airtel, the smartphone network.
and
Admissions for Senior 1 to Senior 5 will start as soon as results are out. Tuition per term for Senior 1 is 980,000 shillings and for Senior 5, 990,000 shillings. For any inquiries, call 0775 83 66 64.
A warm welcome and a good evening to yet another exciting episode of our technology show, Innovate. You know, it is your one-stop shop for all your technological needs. Here we bring you all the ease in the world of technology and globally. I am your host, Brenda Kimbabazi. But first, a sneak peek into what's making highlights in today's show. On today's show, we bring you the ClinicMaster International that just might help you integrate all your health systems in your hospital or clinic. Also, for our security tip, it's all about WhatsApp. We bring you the end-to-end encryption that just might save you from hackers who would like to check your WhatsApp messages. We also bring you the solar-powered water pump that just might save most of the farmers out there who get into problems because of drought and famine. As well, Huawei signed a memorandum of understanding with the government of Uganda to provide all means and ICT services to the country. This and much more on today's show. Now, enhancing accuracy of data capturing, processing, analysis and reporting need a lot of work given the different operations that are done at the different health institutions here in Uganda. But now, this is more efficient and effective due to the sense of accountability brought by ClinicMaster, a web and mobile-based application. We bring you how it works. ClinicMaster is an integrated new generation healthcare information management and medical billing software. It automates patients' transactions in the clinic on a visit basis and daily procedures.
ClinicMaster is a company responsible for the development and support of ClinicMaster software. ClinicMaster software is a health information management and medical billing software capable of automating patients' transactions and records in a hospital or clinic on a daily basis.
ClinicMaster is targeted towards all health institutions to increase efficiency through alerts and documentation, as well as scheduling appointments and visit handling.
If you analyze a small clinic or even a big hospital, all of them have a clinic. So it's all about clinical information management, whether it's in a big hospital or a clinic. If you kind of look at the processes, for example, in a small clinic, you'll find a doctor, a lab person, somebody in pharmacy, and also in a big hospital, it's the same. The only difference, you have more doctors compared to a small hospital, but the process, the flow is the same.
From 2006, the team has been at developing ClinicMaster, which was made commercially available in 2010, with the ability to provide doctors with a full patient's medical history for all visits.
The development, we started developing ClinicMaster around 2006. So we took about 4 years developing and analyzing, coding, etc. Then we became commercially available in 2010. That's when we got our first client in 2010. And since then, we've just been adding on through referrals up to today.
ClinicMaster is a system whereby your doctor will type notes directly into a computer rather than rely on pen and paper. Your medical records will be on one electronic file, organized so that the doctor will quickly know your medications, allergies, latest test results, and the rest.
We are looking at the different benefits that ClinicMaster will provide. We'll look at the 3 categories or 4 categories. Largely, you or me, the patient who could go to a hospital or a clinic, the owner of the hospital, might be the staff working at the hospital, and partners like insurance companies, those who send their patients to receive treatment now. You or me, the patient, you're going to spend a shorter time in a hospital that uses ClinicMaster.
It is both mobile and web-based.
This picture here presents a conceptual framework of how ClinicMaster system works. The broad picture. So conceptually, in any hospital, any typical hospital, a patient will interface with the hospital at the reception. Having reached at the reception, it will depend on the system, the working systems of the hospital. In some hospitals, a patient first pays before getting any service. But in other hospitals, he's sent straight to the triage where his vitals are captured. Talk of the temperatures, the height, the weight, and all that in the triage. Then from there, having captured all that, they are electronically sent to the doctor, who receives an alert that there is a patient in the queue waiting. Then the doctor calls in the patient. The doctor works on that patient. But in some instances, some investigations are required, whereby the doctor sends an online request to laboratory and other investigative centers like radiology, x-rays, and all that, whereby when the results are ready from these investigation centers, the results are sent online. The doctor receives an alert that results are ready. He attends to the results, interprets, and then sends the patient either to pharmacy or to other areas.
ClinicMaster is highly customizable, can be used on a standalone computer or on a network serving multiple requests by any healthcare provider. With over 80 clients today, ClinicMaster continues to expand even as far as Kenya and Sudan.
Currently, we have over 80 hospitals and clinics in Uganda, in Kenya, and also Southern Sudan. Majority are still actually in Kampala.
This team have quite a number of accolades to their name.
We normally charge setup fee at the beginning, or call it license fees, depending on the number of users a hospital is going to have. So we normally charge per user about $400 per user, but that cost will take care of our installation and the time we set up the system. Also, we charge training fees, about $12 per hour per person. And then after that, after 1 year, we normally charge what we call a support fee, which is about 20% of the total cost.
Just like the slogan, innovative solutions for e-health, it's no doubt, they are one of the leading systems for the development and support of ClinicMaster software. WhatsApp has always prioritized making your data and communication as secure as possible. And today, we are proud to announce that they have completed a technological advancement that aims at making WhatsApp the most private and secure application with the end-to-end encryption. We'll bring you how it works and how you can install it on your phone. But for those of you that have WhatsApp upgraded, it is a plus for you. It comes pre-installed. Check it out. From now on, when you and your contacts use the latest version of the WhatsApp application, every call you make and every message, photo, video, file, and voice message you send is end-to-end encrypted by default, including group chats. When you send a message, the only person who can read it is the person or group chat that you send that message to. No one can see inside that message, not even cyber criminals, hackers, or even oppressive regimes, not even the WhatsApp developers themselves. End-to-end encryption helps make communication via WhatsApp private, sort of like a face-to-face conversation. But all you need to know is that end-to-end encrypted messages can only be read by the recipients you intend. And if you're using the latest version of WhatsApp, you don't have to do anything to encrypt your messages. End-to-end encryption is on by default and all the time. Encryption is one of the most important tools governments, companies, and individuals have to promote safety and security in the new digital age. Recently, there has been a lot of discussion about encrypted services and work of law enforcement. But while we recognize the importance of work of law enforcement in keeping people safe, efforts to weaken encryption risk exposing people's information to abuse from cyber criminals, hackers, and void states. While WhatsApp is among the few communication platforms to build full end-to-end encryption that is on by default for everything you do, we expect that it will ultimately represent the future of personal communication. Today, more than 1 billion people are using WhatsApp to stay in touch with their friends and family all over the world. And now, Every single one of those people can talk freely and securely on WhatsApp. Innovate takes a very short break, but we'll be right back. Don't touch your dial.
Innovate is brought to you by
Get in the box with Airtel Yola Maja, where you can Yola up to 2 million shillings daily or up to 20 million shillings in the grand finale. Dial *185# for Airtel Money.
Airtel, the smartphone network.
and
Admissions for Senior 1 to Senior 5 will start as soon as results are out. Tuition per term for Senior 1 is 980,000 shillings and for Senior 5, 990,000 shillings. For any inquiries, call 0775 83 66 64.